Good morning, Queensland. So today we have some good news. So even though the numbers might seem a little bit large, it's good news. So we've got 7 new cases, 3 overseas acquired detected in hotel quarantine, 4 locally acquired. We have 47 active cases, 13,588 tests yesterday. So thank you everyone who's coming out and getting tested. And remember, if you're sick, stay at home and go get a test. And over 4,000 vaccines were delivered by Queensland Health yesterday. So in relation to the 4 cases, and Dr Young will go into a bit more detail about these, but they're all linked, so that's really, really good news. So the first person was the person of interest reported late yesterday. They were a close contact of a worker at the Greek Community Centre. The second person is a child of that worker. The third is the partner of the case who travelled to Yamundi, and the fourth is a colleague of the case who travelled to Yamundi. And the last one is a significant case because our contact tracers have done some really good detective work, and they think they've worked out the link of how this cluster's linked together. So that's really good news. So I'll leave that to Dr Young to go into more details. Now, of course, all of these are the alpha strain. So another piece of good news is that we do not believe that the Delta variant is circulating in our community, which is excellent news. And it's now 2 weeks since the Portuguese restaurant outbreak. So, at this stage, it's all systems go. We're feeling pretty good at where we are at the moment. And we just need everyone to keep doing the right thing. Like I said, it's really important that everyone continues to wear their mask. They check in using that QR code wherever they go outside to restaurants and cafes and venues, hairdressers, the like, all of that. Make sure you're checking in. And of course, fundamentally, it's so important, if you are sick, go and get tested, because as Dr Young always says, we want to get that first case so we can get on top of it very quickly. So can I thank Queenslanders for their excellent work. Of course, we've got a week and a half to go of the mandatory mask wearing, but it just goes to show that those short, sharp lockdowns do work. They actually give our contact tracers that vital time that they need to get on top of things, and fingers crossed that will continue going quite well. Can I just also mention, before handing over to Dr Young, just an update about vaccines, and then the Health Minister will address this in a bit more detail, and quarantine, and the Deputy Premier will address that in more detail. So first of all, in relation to vaccines, can I thank everyone who's come forward to get their vaccine. And we've had, I think, over 92,000 administered by Queensland Health over the last week, which is tremendous work. And I really want to thank Queensland Health for upscaling that delivery of the vaccine. So that's been a tremendous effort, and they're doing a great job there. Now, what we do have, and I think Jack asked this question yesterday, we have 139,875 Queenslanders who've now registered to get the Pfizer vaccine. Now, what I just want to say to those people out there is that you will be given a booking, but the booking may not be until October or November, because that's when all the supply comes in from the federal government. So I just need everyone to be patient, and if we do get extra supply in, Queensland Health will contact you and will be able to move your appointment forward. So we can see that Queensland Health can do nearly 100,000 vaccines a week, which is great news, but the supply into the future before that big dose of supply comes in October is around 65,000 a week. So, and of course the Commonwealth has started some of the GP networks with the Pfizer as well today. So look, our aim is to get everyone vaccinated safely and as quickly as possible, but of course that depends on supply. Now finally, I just want to talk about quarantine, and the Deputy Premier will talk a little bit more about this. My position still remains that we need both. We are working cooperatively with the federal government about the site near the Brisbane airport, and the Deputy Premier will update everyone about that. But if we are going to get to the stage where we stop using the hotels, we need both centres. So we need the one at Toowoomba and we need the one at the Brisbane airport. So that's our position. We're going to keep working with the Commonwealth on both of those, but we are having very productive discussions with them around the Brisbane airport one. So I'll hand over to Dr Young, then the Deputy Premier will update on quarantine, and then the Health Minister will update on vaccines.
Thank you, Premier. So 4 new community-acquired cases overnight. One of them we announced late yesterday. That's the woman who's staying in Tarragindi with family, and she tested positive. She's a close contact of one of the cases in the Greek Community Centre. So she tested positive. Now her child has tested positive, and that's to be expected. Then the third case is a colleague of the man who travelled up to Umundi. He lives in Cinnamon Park. So we're just getting all of his venues of concern. We're talking to him this morning. And then the fourth case is the partner of the gentleman who travelled up to Umundi. So that's to be expected, and most of the venues he's been at were the same as his partners around that Umundi Sunshine Beach area in the northern part of the Sunshine Coast. So there are 4 new cases today, all closely linked, and we can work through all those, and we'll be putting out any additional venues following discussion with those people. Now, the good news is that we have found where a venue of concern is, that we know that 3 of our cases that we were having difficulty linking all attended at the same time. So I'll just get that detail. So it's the Zeus Street Greek Kitchen at Westfield, Chermside. So we know that the case at Aruna, remember that gentleman in the southern part of the Sunshine Coast, the gentleman who went up to Umundi, and the Prince Charles Hospital worker all attended that restaurant. So we're just working out all of the specifics, but we think that is probably the site of transmission that this has occurred. So at this stage, we now have 23 cases related to the Portuguese restaurant and the Greek Community Centre. And I haven't found the exact link yet, other than the genome sequence, between those 2 clusters. But we are just doing some more work there. But for everyone else, we believe we've found both the genome sequence link and the epi link. The only other one that we need a little bit more work on is that DFO worker. They had a lot of common contacts, but we're not quite sure the exact person that they acquired the infection. So that's all good. So that means this cluster of the alpha variant is all coming together, and we're finding out where all the issues are. Now, we need a bit longer to work through this, to manage all of the cases, and I expect we'll see a few more still come through, which is why, until we get it totally under control, we do need to continue to wear our masks, to check in. That is so critical, to check in wherever we're going, and just ask. If you can't see the check-in app, sign where you check in, please ask and make sure you do it, because that means we can get things done so much more quickly. And maintain that social distancing where you can, wash your hands, do all of those things, and most importantly of all, absolutely, if you're sick, stay home and get tested. That's absolutely critical. Thank you.
Well, as you all know, we've been working since September on alternatives to hotel quarantine, and that work is now more urgent than ever because of the Delta strain. We have a detailed plan for a facility at Wellcamp, and I'd like to thank the Wagners for the work that they have done with us on that, developing that very detailed proposal, and we remain committed to that facility. We think it has distinct advantages, not the least of which the planning is already done and ready to go. But we have agreed to progress along with the Commonwealth planning work for a facility at Pinkenba. we have agreed with them detailed specs of what that facility should look like and a scope of work to do the feasibility and planning work. Consultant AECOM have been appointed as the lead consultants to develop that plan. We have proposed that it would be 1,000 rooms, which would allow for 1,450 people at a maximum. That we could see 800 people per fortnight arrive in the first stages, the initial stages, which would allow roughly 2 repatriation flights, 2 Australian government repatriation flights a week to bring home those stranded Aussies. The 29-hectare site will require a range of consultants working under AECOM. They will work through the master planning and town planning implications, the timeframes of getting the facility up and running, the infection control mechanisms that can be put in place, what transport arrangements will be needed, and cost estimates. I understand the officers from the Commonwealth and state government are meeting again at 11 today. There is a lot of work to be done, but we will work with them as quickly as possible. In the meantime, I just underline that we have a detailed plan available for WellCamp, and we'd like to see progress on both facilities.
Well, thank you again, Queenslanders, for coming out and getting tested and getting vaccinated and doing the right thing, complying with the directives. We are getting closer to that deadline of the 9th of July, so I remind businesses that you must register for the Queensland Check-In app and have it very well displayed in multiple sites as you're entering the venue. So we suggest you putting it in different spots so people don't all queue up in the one place. If you don't want people gathering close, then it's best to have the app actually, the QR code visible in a number of places so people can check in easily. Can I just, everyone's been doing a great job in wearing the masks, but can I just say to people, having the mask hooked around your ears and wearing it under your chin is not wearing the mask. So can I put a shout out to, I'm noticing at different places, people walking around with the mask under their chin talking to people. That is not going to help you. It's not going to keep you safe, and it's not going to keep other people safe. So please make sure you're wearing your mask properly for it to really provide the protection for you and for your loved ones. Now, on the vaccinations, the great news is, as the Premier said, we did 92,995 vaccines in our state hubs over the last 7 days. So thank you again to every person who is working at those centres. We've got people managing traffic and lines, we've got the admin staff, we've got the health workers, the nurses doing the vaccinations. I thank each and every one of them for their fantastic effort, and thank you to the Queenslanders coming out and getting vaccinated. We have already completed 615,144 vaccination doses through our state clinics. We have 228,250 people already booked in. So almost 230,000 people are already booked in to have a vaccination through one of our state-run community hubs, and I thank them for that. 86,000 of those are first doses and 142,000 second doses. As the Premier said, we have over almost another 140,000 people who have registered their interest who want to make a booking. So we will be contacting those people shortly to advise them that we will be opening up new booking slots, but those booking slots will be from October on when we get the additional vaccine. Right now, our vaccine administration is going up. Every single week we are vaccinating more people, but our supply is stagnant. So the amount of vaccine we're getting from the Commonwealth every week throughout July, August is the same. Now, we've asked for some of that supply to be brought forward, but we're waiting on an answer for that. But irrespective, the total number of vaccines we're going to get over July, August doesn't change. And so we do need to make sure we are prioritising everyone who's already got a booking, all of our frontline health workers and frontline staff, and of course anyone who is due for a second dose. So if you've had your Pfizer vaccine, your first dose, and you are finding it difficult to find a booking for your second dose, you must get vaccinated with your second dose between day 21 and 42. We ask you to ring 134 COVID so that we can make sure we can get you in within that window at one of our vaccination hubs. It's really important that everyone who is due for their second dose comes forward and gets their second dose. So please ring 134 COVID if you're having any trouble finding a booking slot already at one of our state vaccination clinics. We look forward to being able to increase our vaccinations from October, but of course this is all subject to supply. But we will book people in, and as long as the Commonwealth can guarantee that we'll be getting a lot more vaccines from October, we can start vaccinating a lot more people from October. Of course, some GPs have started this week with Pfizer, but it's very small numbers. That will grow over coming weeks, so people please be patient if you are trying to get a booking through a GP. And of course, as I say, all of those people who register with Queensland Health, we will make sure you get a booking slot, but it may be October and later when we get the vaccine. Thank you.
Thank you. With the lifting of the lockdown, we did see a lot more people out and about yesterday, so we did hand out 235 masks, so that was a significant increase, no doubt because of the larger numbers of persons out and about. So the reminder for everyone is to not only just make sure you wear the mask, but please make sure you carry it. So obviously in all of those instances the people had not carried their mask, so provided a mask by police and they did wear it. Nonetheless, there were 3 persons who, after being given the opportunity, refused to wear the mask, and they have been fined $206 each for not wearing the mask. And we had one further penalty infringement notice for a member of the public who was in hotel quarantine in one of our hotels in Brisbane, who declined to stay in their room after being directed to do so, was found in a fire escape and returned to their room and fined somewhat more, $1,300+. Overall, very good at our borders, so 2,206 vehicles, no turnarounds at all, which is very good, high levels of compliance. We did see 28 persons come into quarantine from domestic airports and 92 international arrivals, which takes the total number of persons in hotel quarantine to 3,122, including 763 persons from domestic arrivals and 2,269 from international arrivals. Thank you.
What hotel was that?
4 points in the city.
And was there any risk to anyone else?
No, it's found in the stairwell. So we have, as you know, we have monitoring systems and officers on site, so that person had previously been spoken to for their behaviour and then persisted with it, so they've been fined fairly heavily.
Is there a reason they wanted to get out?
No, I don't have that detail, but it doesn't matter what the reason is, they're not allowed out. Thank you.
Do you have a cost, a rough cost of what the quarantine proposal in Inala would be?
No, not at this stage, but remember they've said they will pay for that.
Just to
Will
clarify.
they pay for the running of it or just the building of it?
No, the construction of it is my understanding, and then we would provide the services.
Previously, the government said it wanted these quarantine lots to run in tandem with hotel quarantine. Is that no longer the position? Not all hotel quarantine shut down and just these?
If we had both quarantine facilities, so if we had the one at Brisbane near Pinkenba and we had the one in Toowoomba, we would not need to use the hotels.
Why don't you just give up on lockdown? Morrison's
Because
not gonna- they're not gonna say yes,
it's
are they?
fully costed, it's ready to go, it could be built in 2 months.
But it doesn't matter then.
It could be up and running. Now this one in Pinkenba is not going to be up and running for what, early next year, DP? Early next year. And the proposal in Toowoomba could be up and running in 2 months. And we know that there would be flights that would be willing to fly there.
Given that the PM isn't going to say yes, are you
Yep.
looking elsewhere around the state?
No,
So that's it.
that's it.
On vaccines, so we're getting
Yep.
64,000 a week, but we're vaccinating 92,000. What's that? That's 30,000. Is that people being vaccinated with AstraZeneca, or where's that supply coming from?
No, my understanding is that's the Pfizer.
Yeah.
But what's happening is that we'll only be getting the around 65,000, is my understanding, until the bulk of the supply is due in October. So we're asking people to be patient. We're waiting on the Commonwealth supply so we can make sure that you get your dosage.
So is that 30,000
Sorry?
extra in the fridge?
Sorry?
That extra 30,000 that was done last week, is that just left over from previous deliveries?
No, because we've got some extra initially.
8 days supply.
Yeah, we've got 8 days supply, yeah. But we've got to make sure we've got the second doses.
Is there a case for Australians returning home who have been fully vaccinated to quarantine at home rather than hotels or anything?
What they've said is that they are looking at a trial in Adelaide, first of all, to see if it works, because you have to have mechanisms to ensure that people are staying at home. And don't forget, you can still have the virus and you can still transmit the virus. So that's got to be the work that's being done by AHPPC and National Cabinet. Yes. I think the DP's got that. 1,000. Yeah. Yeah. Yeah, sure. Thanks.
Prince Charles Hospital, is it going to close or shut down anyway because of the second case?
Not at this stage, and I'm really pleased with the work that's been done by Q Health to find this link. So I know when the public hear that there's a health worker who's been positive, they just assume that they've actually contracted it in the hospital. But we've got to remember these people go out, they live in the community, they shop in the community, and I suspect this has happened around the world where health workers have actually contracted it in the community and brought it into the hospital, and that's what's happened. Luckily, this person had only worked one shift. That contract tracing work is being done and close contacts are being put in quarantine. So we're very satisfied at this stage that it's being managed.
Could the first woman go to the cafe in the foyer at the hospital? Could this second person not have picked it up there?
The link is this person has been at the same cafe at Chermside Westfield as the gentleman from Maroona and the person from Yamundi. So there is all on the same day, same time. It is an exposure site, so we're definitely seeing, just as we saw with the Portuguese restaurant and we've seen with the Greek community centre, we're now seeing this particular cafe.
So the chance to call it the community rather than the hospital?
Yes.
Is the hospital still on code yellow?
I would have to check the current status of the hospital today.
Just on that, have elective surgeries been cancelled at Prince Charles because of this, or only outpatient services?
So because this case occurred over the weekends, there's no elective surgery over the weekend. We've been managing this so far. Whether there's been any rescheduling of any surgery, I would have to check with the hospital. But at this stage, I think everything is still progressing as planned.
Do you have an update on the 69-year-old man who was in ICU?
So he is on a ventilator now, but he's being well looked after, and yes, we're all hoping that he'll do very well.
So that facility at Pinkenbar, would those health workers then be living at the facility to avoid what we saw at Prince Charles?
There's a lot of work to be done. The Deputy Premier just went through all of the logistics that has to be worked through with the Commonwealth as to how this facility would be built and how it would be managed. But the reason why we've been promoting regional quarantine was to try to have all of the staff at the same place. So if there is any transmission, you're not having them going out into the community because they're residing where they're working. So, but yeah, we have to see the detail of what the Commonwealth is planning.
Oh, Dr. Young, sorry.
So was there any more preliminary findings from the investigation last week?
No, that's still ongoing, remembering the young woman who was the first case at the hospital there is still in hospital, still positive with COVID. So although the other work is ongoing, we have to wait till she's well enough to be interviewed as well.
Last one. Dr. Young, just on that Delta strain, are you now feeling a bit more confident that there's not more cases out there in the community, given we've seen very little spread?
Absolutely. So we had a lot of potential outbreaks there. So we had the 2 workers at the airport. Then we had the flight attendant whose co-worker became positive. And we had the worker at Prince Charles. But we've done an enormous amount of testing around all of those. Oh, and sorry, the miners as well. We've done a lot of testing around all of those and not found any cases. And we know that Delta virus tends to transmit fairly quickly. So we've got an incubation period of 14 days and we could see that, but we know that the vast majority would transmit fairly early on in their incubation period, and we've done all that testing and not found any cases. So we're not totally out of the woods yet, but I'm fairly comfortable.
Thank
So
you.
vulnerable people still stay at home, unvaccinated vulnerable people?
Yeah, if someone is over the age of 70 and they haven't got vaccinated, they should think about what their risks are and what they should do. Yes.
Gotta go. Thank you.
Thank you.
Thank you.